Hello and welcome to another episode of Clean Talk, the Infection Control Podcast. I'm your host, Brad Whitchurch, and we are coming to you live from the beautiful Seal Shield Studios in downtown Orlando, Florida. Very happy to have my guest with me today. It's Julio Lainez with Vision21. Julio, welcome to the show. Tell us a little bit about yourself and why you're on Clean Talk here today.
Well, thank you for having me. It's great to be here. Well, as you said, I'm from Vision21. Vision21 is a company that is actually based out of Wake Forest in North Carolina. Vision21 is a reseller company. So we work on with different manufacturers, including yourself. We have different verticals that we work with. And one of the verticals that we work with is healthcare vertical, which is how we get to know, different manufacturers like Seal Shield and other manufacturers that we could bring into our customers and show them the type of relationship that we have with the manufacturers.
Well, fantastic. We're going to dive into that. There's so many things to talk about. Now, we are an infection control podcast, but as we've been discussing, there is a relationship between IT and infection control. And when IT is making decisions around the information technology, they need to have an awareness around the needs of infection control. And certainly in post-COVID, we're seeing a lot more merging between infection control and other departments such as IT. So I know you're crossing into all those other spaces. The other thing I'm looking forward to talking to you about, Julio, is your experience in the international market. So I know that you're doing healthcare business, not just domestically here in the US, but in other international markets as well. And I know our audience is very interested to hear your experiences as it relates to healthcare in different international markets and the COVID response in international markets. So we're all living in this COVID world, and we have our experiences here within the United States and within our own individual states. But what have you seen that may be a little bit surprising to folks in America in terms of how international countries are dealing with the COVID pandemic and any steps you've seen them taking from a healthcare standpoint? Can you tell us anything about that?
Yeah. So one of the closest country per se that is very close to the U.S. is Puerto Rico. For some manufacturers, Puerto Rico is part of the United States. For some manufacturers, Latin America. Being so close, you might think, right, that it's a little bit different. Puerto Rico has taken kind of like the same approach that the U.S. have taken. They get hit with FDA HIPAA compliance, so they have to follow all the different steps and all the different things that need to be followed. So infection control is something that they're very into as well. When we're talking to the IT guys, especially in the healthcare area. You now see that it's not just IT. Within their IT department, they also have nurses staff with them sitting there. And that's how they know what they need. The reason why they have these nurses is because they need to understand from their nurse perspective, what are the things that they're going to be using on the car size. What do they need in the cars? What are the different requirements that are being asked for them to be able to get different credits from the government to be able to meet that standard and be able to sometimes get the different fundings that they need to get. So nowadays you see that IT is very involved in this type of decisions when it comes to infection controls.
Well, let's talk a little bit about healthcare IT, because we're talking earlier, and I think a lot of our audience recognizes that healthcare IT has evolved over the last few years, largely because of the implementation of EMR solutions.
Definitely.
So, you're talking about Epic and Cerner, and then all of the hardware that comes along with supporting those electronic medical record softwares. And then COVID comes along. And once again, we're kind of shifting in our focus on how we're doing our purchasing and the strategic buys that we're making. That's been the domestic story. Is it the same story in other countries? Are they driving EMR solutions forward? And have they had to make adjustments as a result of COVID as well?
Actually, that's something that you're starting to see more and more now. It was something that is starting back in 2019 before COVID. As right now, we have HIMSS, the HIMSS chapter in different areas in the U.S. You have the HIMSS chapter Puerto Rico. There was also
HIMSS, the Healthcare Information Management Symposium
Exactly. And well, now, back in 2019, you also have the HIMSS Latin American chapter, which got let go because of COVID. And now they're beginning to come through again. Reason why is because you have a lot of hospitals in Colombia, in Argentina, in Dominican Republic, that there's a lot of people going outside to try to get treatment. Why? Because sometimes it's cheaper, right?
Destination healthcare we're talking
Exactly,
about, right?
exactly. Sometimes it's cheaper, and it is cheaper. Just Puerto Rico per se, you get surgery here, open heart surgery, you could end up paying $100,000. Down in Puerto Rico, it's $50,000, and then they could set you up in a hotel until you recover, and then you go back home. So a lot of these things are happening in Latin America, and what they're trying to accomplish is, okay, why do we need to have EHR? Because we want to know what this patient is being treated for, right? Is this patient suffer from X amount of illness or whatever? The only way they're able to see that if they're able to get into your medical record through the different resources that are available. And that's why more and more you start seeing Latin America getting into that type of mindset where now we have to start implementing EHR as well.
Now, and we talked about this earlier, several countries, I think you said, had EHR initiatives that then were stalled by COVID and are now being picked up again. What can you tell us about that?
Yeah, for example, Colombia back in 2019, November to be exact, there was a law where government came out and say, hey, nowadays, with all the what's happening right now, we have to transition to medical records. And they implemented the law, which got stopped in March because of COVID. And now they're transitioning to that again. So the funding is there. They know that the need is there and they know why they have to go there. And that's what they're trying to do right now. And more you start seeing this, because I've seen it as well in Ecuador, where Ecuadorians are starting to do the same thing. They're trying to merge and do the same thing that the US is doing, because they know that within their population, there's a lot of people that either they leave from their country to the US and then they want to come back because it's cheaper to do different things over there, or they have different type of things like breast implants, things like that. And a lot of women are coming to these countries to do it because it's cheaper to get it done there. So that's why they're trying to implement this type of things.
So what have been some of the obstacles internationally for EHR implementation? Are they able to use the same systems we're using here domestically, the Epics, the Cerners, the Meditech? Are these companies entering into these foreign markets to have transparent communication with US healthcare, for example?
Well, there's a lot of difference on the different companies that sell the EHR, right? For example, your Epics, they don't work with entities that they don't have over 650 beds. Now you're going to see that a lot in Latin America, right? Because they're not a huge hospitals. So for them, it's going down to Latin America is not that much of a revenue driven. But when you see people like Meditech, I mean, they're already down there working, like in Puerto Rico. They have a huge market right there, and they're trying to be the number one in the EHR war in Puerto Rico. I think that one of the things that have kind of like stole a little bit the EHR down in Latin America is the language barrier, because a lot of this are coming from the US and everything is in English, right? So being in Latin America, not everybody speaks the language. So everything being in English makes it a little bit harder for them to try to comprehend or try to do different things. I think nowadays, a lot of companies, what they're trying to do is trying to transition their mindset where they have to start doing different type of ways to put different languages, not just Spanish, but different other languages, because this is something that is being done in Germany as well. And Germany is not full English, right? So it's a lot of things where all these EHR companies are trying to, they need to start transitioning, making different changes in order for customers that are needing to go to that spot, being able to take them into consideration.
Sounds like a big opportunity for some of these EHR companies.
Yeah, definitely.
Especially if it's a little below Epic's threshold. A lot of people speak Spanish. I think I see a big opportunity there.
No, most definitely. Yeah. I mean, and it's crazy because, EHR is not something that is the cost is big. I mean, the lowest EHR could go from 12 millions all the way to, sky's the limit, depending on what bundles you want to put in there.
Right.
Because as you know, EHR is not just medical records. It's all about includes from tying into the pharmaceutical side, because the doctor needs to send the medications to a next specific pharmaceutical or billing department, right? Billing department is tied to that. Insurance companies, they need to have all this too as well, because they're the ones paying the hospital, they're the ones paying the doctor. So it's not just hospitals getting into this. Now you see it all across, even in the government, because Meditech has a platform specifically for the government side. So EHR is not just on the medical side.
And it's interesting, we talked about it earlier. It's not just the cost of the EHR software. It's not just the cost of the implementation.
Right.
It's all of the associated IT equipment and hardware that has to be updated. Epic, of course, is a highly mobile device centric system. And so, we were talking about it before. 10 years ago, not a lot of hospitals were investing in iPhones. And now all of these hospitals that are on these EHR systems, they're all centralized around iPhones and tablets. And then you have progress through technology that leads to other challenges, specifically infection control. So now you have all these devices, iPhones that you didn't have in the facility before, accessing all levels of that facility. What steps do you have to take, not only from an IT standpoint, from asset management, but from an infection control standpoint? How do you make sure that these devices that are providing us so much benefit aren't causing a cross-contamination dilemma?
Right.
Have you seen any changes, whether it's from the EHR or from the COVID pandemic, in the way that your customers are thinking about their IT purchases or their spends, or the type of equipment that you're quoting out today? Have you seen any changes?
Yeah, I mean, there's a lot of changes happening right now, and I think we were having this conversation earlier where the way that I see EHR or how hospitals are looking into EHR is how majority of the business was looking at disaster recovery, right? That's one thing that people didn't want to look into it, but something happened and now they want to go. We know that being on the clean side or all those type of things, something that is always have to be done, because you're in an emergency room, so everything has to be sterile, even the monitor that is being used, or if the screen protector, it's medical graded. Those are things that a lot of people were not looking into before. That now you have to start looking into it, because a computer, a fan of a computer could catch and then through the dust could catch some sort of things that could be infected for the patient and everything. So now they're starting to look into this thing a little bit different after COVID. And companies, if the resellers or the manufacturers are not looking into this, I mean, there's a lot of things that not just on the hospital side have to change, but also on the way that resellers are doing and the way that manufacturers are doing, to be able to pass the correct message of the product that they're actually offering.
And what's the different approach that you take based on these issues, depending on the market, right? Is it a different discussion with U.S. hospitals versus, say, Puerto Rico or Colombia or these other areas where I know you have expertise?
Well, I think that what works for me, especially when I'm going to talk to the Latin American market, is more try to show them what we have done on the U.S. side, Puerto Rico side, and you want to emphasize Puerto Rico to Latin America, because that's kind of like the closest that what they have to compare to what they do. And show them what, as a company, we have done to help them out, right? What type of manufacturers we're bringing, what's working now for them that has generate different safety concerns that they being able to overcome. And by doing those type of things, by showing them what it had worked in Puerto Rico and in this hospitals, and probably naming a few hospitals and probably giving them information of what we've done, makes them think and makes them understand, you know what, yes, we need to do that, or we need to take this into consideration.
Well, I love your perspective on this, and I want to pick your brain some more about the international markets. I know that your experience in your career, you've worked with Dell, you've worked with Lenovo, lots of companies in the reseller space, Insight. And I know you've worked in Canada, you've lived in Canada, you've worked domestically, you have experience in the Latin American market. Outside of the US, if you could pick one of the markets where you have experience that you think, this is the market to watch of all these others, here's where I think there's going to be opportunity in the future, what would that market be and why?
Well, I mean, if we're talking about Latin America, I think areas like Colombia to try to take advantage of, that law that was passed back in 2019, and they're trying to do it right now. When we're talking about all the changes that are going to happen there from an EHR's perspective, all the way to what that comes along, because I mean, customers could go ahead and buy the EHR software, but that doesn't mean that they're ready, right? We're talking about, okay, so now this is the EHR, now we'll have to implement it. Now you're going to need, your PCs, now you're going to need your network, now you're going to need your cards, now you're going to need, and when you start saying all these things to these customers, it doesn't become that and just an EHR software. It becomes a whole different solution. And I think that, Latin America wise, Colombia will be one of the areas where I could concentrate a little bit, and then progressively start doing the same thing in other Latin American markets. Costa Rica, Mexico's already there. There's a lot of changes. And Ecuador, which is doing a lot of changes as well, and then progressively continue doing the same thing in these different markets.
What about budgets in the Latin American markets in particular? I mean, how much does budget differ from country to country? And is the healthcare system, are these federally funded initiatives? Is the budget there to move this forward the way that Colombia is beginning to implement this EHR migration?
Yeah, actually, it's interesting because a lot of Latin America, they don't depend much on the government side. You see a lot of private hospitals, right? Where by being a private hospital, they have the money. It's like what happens in Puerto Rico. Puerto Rico, a lot of people might think, oh, Puerto Rico doesn't have money because when you look at the news, they owe so much money, but that's the government side, right? But you don't remember that there's like 80 something hospitals down in Puerto Rico that are private, where those private entities, they do have money, where they're able to spend, they have the budget. And some of this hospital, they're not even looking about, oh, this is going to cost me X amount of dollars. Is this going to do the work for me? So they don't have an issue as far as spending the money if they know that whatever they're going to buy is going to be efficient for them. And the same thing works with the other countries. I mean, on the private sector, money is not an issue. Probably you'll see that issue on when you try to work with the government side. But even there, I mean, money is there. It's just trying to find a way of how to show them what's going to work for them.
Well, when we talk about destination healthcare to lower costs and improve experience, the lower cost, at least in my perspective, is only a benefit if the quality of care is as good or better. So how much does competition with domestic healthcare kind of drive best practices in some of these destination markets?
Well, let's talk about Puerto Rico in that area. I mean, doctors from Puerto Rico are graduating in Puerto Rico, and they're not staying to work in Puerto Rico in any hospital. They decide to come over here, which means that whatever degree or whatever area field on the medical side they could actually do it over here. So on what I'm saying there is that these doctors, even though they're graduating there in Puerto Rico and everything, they have the quality that they provide to their patient will be kind of like the same that you're going to get over here. The fact that they're coming down over here to offer their services, so you could go over there and get it, because cost-wise, I mean, like we were saying before, something that could cost you $100,000 over here could cost you 50 over there, and you have the benefit of using your different insurance plans, or your Medicaid or the Medicare. Actually,
all accessible,
exactly,
transferable.
And again, it's Puerto Rico per se. They HIPAA compliance, FDA compliance, so they have the same compliance that you have here. So practically in that end, you don't have to worry about that. Now, when we're talking about other places besides Puerto Rico, I think that's one of the reasons why they want to get into the EHR type of thing, so they could be able to be within certain requirements. So people that are going over there to to do different type of surgery because it's cheaper, they could have a peace of mind that whatever they're going to be doing, or this doctors could be aware of what they have by being able to get into their what you call it, enter their record to be able to understand if they suffer from different type of illness.
So I wonder, you've mentioned Puerto Rico. Do you see other countries really stepping up as destination healthcare within Latin America? What are the other countries outside of Puerto Rico where, if I wanted to have a positive healthcare experience, lower cost, where might I go look?
I think that depends on what is it exactly that you want to do, right? For example, Dominican Republic is well known for doing different type of transplants, right? Colombia is for the same type of reason. I think it all depends on what is it exactly that you want to go, because there is a lot of this country that are well known for doing good type of surgery on different things. So it depends.
Now, what about the non-surgical aspects? You mentioned that Puerto Rico follows the U.S. guidelines, and a lot of people, certainly in the healthcare industry, we're very conscious of HIPAA, but a lot of patients are kind of, ignorant about that. It's there, you're protected. They don't know what it is. We take it for granted, the privacy protection. Are there these same protections in these other countries, or how do they address that?
Well, I can't really tell you how much they're being protected in areas like Colombia, Dominican Republic, because that's something that they just starting to get in. I know that in Puerto Rico they are. I mean, just like anything, I don't know if you're aware that a medical record, and this was back 2-3 years ago that I attended a certain training. They were telling us that in the black market, your medical record could be sold for $350.
Wow.
I mean, and that's why a lot of this IT companies or IT departments, they have to be very aware of what cybersecurity and all those type of threats, because being exposed could mean even being closed. They could get their hospital closed, because getting all that exposed and selling all that data, it's something that you see it nowadays in black market.
So something to be at least aware of if you're looking to do destination healthcare in some of these markets. What type of privacy, security, compliance do they have in those markets?
Well, for example, again, Puerto Rico. I mean, they have all the type of they have all the security that is needed to be able to let the customer or let the patient know that whatever is going to happen there, whatever information they're going to provide is not going to be exposed or be given or be taken away, so that later on, you're going to have a death or whatever because your social security or your credit card got exposed or whatever. Because you got to remember, again, Puerto Rico is part of the U.S., right? So they do have social securities. They do have everything that we have over here. And so whatever data you get exposed, can be used anywhere else here in the U.S.
And I think a lot of us take it for granted, but that how well we're protected in our domestic healthcare system. Certainly being in healthcare, we know we're conscious of HIPAA. Yeah. We're very aware of HIPAA. Certainly the acute care facilities are ultra conservative with HIPAA compliance. And we as patients typically take that kind of thing for granted. But then when you start looking at other markets, you realize, hey, this is important stuff that we've addressed.
Definitely. And I mean, and you see it days, that's why a lot of hospitals, they're very, very picky when they give computers to doctors, because a doctor could, forget their computer on their car, get stolen and everything, even though there's not data there. But the fact that it's being given by the hospital, that's kind of like a threat. And HIPAA could, they could get fines up to $1 million just because a computer was exposed, even though the data was not exposed, but the computer was, right. And it belongs to the hospital.
Very strict privacy standards in the U.S.
Exactly.
What other differences could you maybe share with our audience that that maybe the international markets, specifically the Latin American markets, do a little differently than we do here domestically, either from an IT perspective or a healthcare perspective? Can you think of anything else that we might find interesting or different?
Well, right now, you could say the majority of Latin America, they're still back in the days where everything was in paper, right? And that's why they're trying to transition. They're trying to make a lot of changes. They did very good. Some countries in Latin America did very good when COVID came, in closing different, their borders, like what we did here in the U.S. and Canada did the same thing. Sometimes some countries in Latin America, they did it before us. So that's why they were not that exposed to COVID as the US or Canada was. I think more and more Latin America is beginning to transition to change. And that's going to make it even harder for the US because as they're changing, the US have to start changing as well, right? To make different because everybody's trying to do the same thing that the US is trying to do, right? So you always have to be one step ahead than everybody else.
Makes sense. Well, is there anything that you want to tell us about Vision21 and the work that you're doing internationally with Vision21 and the solutions that you're providing that you could share with our audience?
Yeah, so as I mentioned before, Vision21 is actually based out of Wake Forest. Interesting about Vision21 is that we're not a box pusher, put it to you that way. We try to sell solutions to the customer. And I think that drives a little bit more sales than anything else, where we don't just want to go ahead and say, hey, customer, come to us and say, I want a computer. Well, yeah, but what you're going to be doing? You're going to buy a computer, or you're going to buy 100 computers. You need security. What you're doing with your security, especially with everything that we just talked about, security risks. You're talking to hospital infection controls. When you start talking to them and you start just not saying, yes, I want to sell you what you want, but also try to position different things, try to show them that, what else is there, then makes it a whole lot of different. There's a lot of resellers nowadays, your big resellers, your small resellers. What makes the difference about Vision21 is the way that we go to market with our customers, the type of relationship that we do. We don't just want to, be your sales guy, but we want to be some sort of kind of different. In my case, I have a lot of customers where before we talk about business, we talk about family, we talk about I know their kids, I know their wife, because I've gone to visit them. I spend time with them, and that it's something that you don't see much in days on the reseller side, especially on the big ones, because they're more, let's do the transaction quick and let's move on to the other one. Versus sometimes if you try to maintain that relationship with the customer, probably you're not going to get that big sell at the beginning, but eventually throughout the years, you're probably going to get more than what you got at the beginning.
So building trust and relationships, but let me ask you, that's gotten more complicated during COVID, right? Fewer in-person visits, more Zoom calls. Has that been a challenge?
It was a challenge, but you know what also helped, at least in our end, and this is something I heard from a lot of these customers was they buy from me, they buy from other people, right? But when COVID started happening, or when Maria, for example, happened, you call these people and you say, hey, how are you guys doing? What are you guys doing? What changes are you guys going through right now where probably we could assist you? And not necessarily to sell you something, but let me help you out. Do you need any help or anything like that? That makes a whole lot of difference for our customers. And I think for the way that we do business too.
Well, I know your customers appreciate it, Julio. And if members of our audience want to find out more about Vision21, what do they do?
Well, they could go to the website, www.vision21.com, and they'll be able to see everything that we have there. I mean, we work on different markets, right? Healthcare is just being one of them, but we also are in the education market, video walls market. I mean, we're not just limited to one specific vertical. We trigger all the different verticals that we have, that there is available to sell to.
Fantastic. Well, Julio, thank you for being on the show. The company is Vision21. Julio Lainez is our guest today. Appreciate you being on the show, Julio. Until next time, be sure to join us on every Wednesday, 3 p.m. Eastern time. And our guest next week will be Michael Ruby, who's the CEO of Microban. Be sure to stay tuned for that. That is May 18th at 3 p.m. Eastern time. Join us then live. And until then, remember, keep it clean.